Joining me now to discuss what's a worrying situation, Chair of the Australian Patients Association, Michele Robbins. Michele, thank you for your time. Look, this will be concerning to people watching at home. What's the detail here? Because obviously this isn't just surgeries. I mean, what about emergency presentations? What else could be impacted here?
Yeah, thanks, Peter, for inviting me on. It is really quite concerning, and I definitely think that many patients and many Australians will be very concerned. So when we think about IV fluid shortages, which is sterile salt water, we are actually thinking about the whole healthcare system. So that is for our ambulance services, through to GP clinics, to dialysis patients, as well as private and public hospitals. So the ramifications of this is quite extraordinary. And I think when you look at all of the aspects to this, the other thing that is really quite concerning is that metropolitan public hospitals and private hospitals have resources where they can actually share those IV fluids if they need to. But another community is going to be impacted is rural and regional communities. So they don't have access to as much stock as you would see here in a city like Melbourne. So we have to be really concerned that that might occur, and we have to think about how we can use those resources wisely. And secondly, I think with elective surgery, that would probably be one of the main issues that would cause more hospital delays, wait list delays, if physicians can't actually do the surgeries.
So how did it get this bad, Michele? How did it get left to get to a critical level like this without the government stepping in earlier than they did on Friday?
Well, I think we do know that there's always medicine shortages, and the Therapeutic Goods Association does monitor this very closely and carefully with manufacturers. And I think that we have seen in the past, and that is pre-pandemic and pandemic, that we have shortages of medicines at various times. And I think we normally can really navigate that. But I think when we're thinking about having a global shortage as this, we're all going to be competing against each market, each country for those limited resources. So I think we have to really think about how we're going to actually deal with this. And it is a good response that the Minister did announce that there was going to be a response group. And we're pleased to see the Australian Medical Association is part of that group, because doctors are going to be at the forefront of this, particularly in the hospital setting. So we really think that we need some more transparency. We need some more information, because at this stage it is very limited, and there's a lot of mixed messages, including, do we actually need to ration at the moment, or are we prioritising certain patients? They might be the emergency department patients, intensive care patients, and surgical patients. So we just really need some more information, because at the end of the day, it's all about patient safety, and we need to make sure that the patients are being treated accordingly.
All right, well, clearly I'm not a medico, Michele, so forgive my ignorance, but if we're talking about just sterile saline fluid or sterile salt water, can't we just make this in Australia, or are we totally reliant on importing it from overseas?
At the moment, we believe that we're totally reliant on importing it from overseas. And I think, this is something that we should really have a really big discussion from a federal and state government perspective on. We do have great capability here to manufacture drugs and medical supplies. And we saw that in the pandemic. So we saw that we had issues getting vaccines, face masks, gloves, and we were able to all work as a community alongside the government to actually start to have manufacturing sites here to relieve that burden. So I think when you're in a situation where there is a global shortage, we've got to really think about stockpiling, which is something that is not an efficient way of managing, or we have to start thinking about having those local capabilities so that we're not reliant on other markets around the globe to actually have
Spot on, Michelle.
These medicines.
I'll have to leave it there, but I'll get some questions. Apologies, I'll get some questions into the Minister's office about what's the genesis of this issue, but thank you for your time.